and we'll start recruiting patients soon. So this is the data integration pipeline. So we are planning to bring in information from EHRs, billing data, pharmacy data, and so on to produce a complete integrated picture for physicians and for researchers alike. So CharmHealth.com is the EHR company that I run on a day-to-day basis. So this company is a cloud platform which has about 30,000 to 40,000 providers, and it has a large number of autism patients as well, and large numbers of psychiatry physicians who are also treating other mental health conditions. So we are looking at ongoing research projects at CharmHealth, including clustering, subtyping of patients, developing metrics, using longitudinal trace to match patient trajectories, advanced reasoning and predictions like matching similar patients, predicting outcomes, and so on. Once again, discovering the comorbid symptoms, biomarker discovery, and also a severity score development to track.
Yeah, Pramila is the founder of the Brain Foundation. They're doing some amazing work. So Pramila, take over. Go ahead, introduce yourself.
Thank you so much, Dr. Uli, for inviting me and for giving me this opportunity to share what the Brain Foundation does, and also the company that I run, CharmHealth, does in this space. So the goal of the Brain Foundation is to catalyze discovery and translational research leading to FDA-approved treatments to benefit individuals with neurodevelopmental disorders. And as Dr. Uli said, there hasn't been much progress in therapeutics for ASD, and right now there are only 2 FDA-approved therapeutics for the core symptoms, and the goal of our foundation is just very laser-focused on medical treatments for ASD, especially for level 3 individuals who need a lot more support. So what we've been doing all these years is our pipeline. In the beginning, we started funding basic science research because, as Dr. Uli said, there hasn't been much NIH support for this basic science, and so we started funding research in 2022, and now then we started funding research in translational drug studies in animals and human longitudinal studies, and then we started looking into data generation and integration from local large institutions that have been collecting a lot of biospecimens in this area. And now we are working on a treatment platform, a discovery platform on AWS Health Lake to integrate the research data and longitudinal EHR data for physicians, research, and industry. And this is with the company that I run my day job, CharmHealth.com. So we are an EHR company. So we are using that opportunity to integrate research and EHR data onto one platform so that we can develop AI tools on top of that to inform researchers and physicians and improve the standard of care. So annually, what do we do at the Brain Foundation? We review and grant about 10 grants of about 100K each, and we get usually about 100 submissions. That shows the amount of need in this space. We also have a data analysis project and integration from key medical centers, as I just mentioned. And we also organize a conference called Synchrony every year, which is our annual conference with physicians, researchers, parents, and adults with ASD. A little more about each of these. So this year we are focused on Stanford Immune Behavioral Health Clinic. They have longitudinal data of about 400 patients with severe neuropsychiatric declines composed of the core features of autism and 150 healthy controls. And we are now looking at biomarkers and also funding a multi-center clinical trial. There is a publication pending on this, and it has been submitted. We are also working with UCSF Neuroscience to look at CSF and serum study of ASD patients for novel antibody discovery. And Wake Forest School of Medicine is doing a histology analysis of GI biopsy samples of ASD patients. So the reason we got here is because we are looking at the data from the clinics that are treating ASD patients who have a number of comorbidities, and they end up in rheumatology or gastroenterology, and then they collect all these samples, and then everything leads up to the immune behavioral component. And then by looking at the data there, we have realized that by addressing those comorbidities, we actually can make a dent in the core symptoms of ASD. So that's how we followed the clues from the research that we've been funding in the past, and now we are leading up to fund multi-center trials. looking at how the effects of treating these comorbidities will actually help treat the core symptoms of ASD. Again, we are also funding one research study which may be of interest to all of you, is speech and language development. You would think that with so much effort that's going into speech therapy and all of that, is that we actually understand what causes the speech and language difficulties in ASD, but we don't. So we are funding a study at Berkeley to look at fMRI images of minimally verbal patients with autism who can handle an fMRI, to look at controls versus ASD, to understand what the similarities and differences are and where the breakdown is occurring in the speech and language production. So this study is now ongoing at Berkeley. So this is the data integration pipeline. So we are planning to bring in information from EHRs, billing data, pharmacy data, and so on, to produce a complete integrated picture for physicians and for researchers alike. So CharmHealth.com is the EHR company that I run on a day-to-day basis. So this company is a cloud platform which has about 30,000 to 40,000 providers, and it has a large number of autism patients as well, and large numbers of psychiatry physicians who are also treating other mental health conditions. So we are looking at ongoing research projects at CharmHealth, including clustering, subtyping of patients, developing metrics, using longitudinal trace to match patient trajectories, advanced reasoning and predictions like matching similar patients, predicting outcomes, and so on. Once again, discovering the comorbid symptoms, biomarker discovery, and also a severity score development to track longitudinally. The most common example you're familiar with is A1C. We don't have a similar score to track the patients here. And we wish to subtype this group into on the temporal disease progression, similar to MS, where we have relapsing, remitting, and so on, so that we can track these patients and see what causes their relapses. And we can come up with better ways to treat them through the course of their life. We also aim at building better clinical AI tools for physicians based on ingesting this EHR data into a knowledge graph, and build research tools for researchers for treatment candidate discovery and patient selection. So here are some models that we have started building. This is not there yet. This is from our labs, but I'm just sharing what is possible. And we are looking at developing this longitudinal trace using a severity score per encounter on the EHR. So in summer, we had Symphony 2025. So those of you interested in this topic, I highly encourage you to please come by. And thank you, Sirika, for being a sponsor and supporting us through this conference every year. It's usually held in the Bay Area somewhere. And this time it was Nasilomar. We haven't yet picked the date for next year, but we have a large number of physicians, researchers, industry veterans, autistic, and people from the community come and give input. So it's a great venue for people who want to have an input into this. We also had this roundtable with Stanford, UCSF, and a group from Italy to discuss this problem of how do you treat recurring deteriorations in the ASD population. So Stanford presented several case studies, and a study starting from about 504 patients with neuropsychiatric deteriorations, assessments and diagnosis of rheumatoid arthritis and other autoimmune conditions in a subset, and then treated them with DMARDs to check what happened to their core symptoms of ASD. And based on that preliminary research study, as I mentioned before, we are designing a multi-center clinical trial with Stanford, possibly Dartmouth, Italy, and Australia, to treat ASD patients with deteriorations with corticosteroids and DMARDs and look at the results. I have an overview of projects that we funded. I'm not going to go through this for lack of time, but these are the basic areas. There's data analysis, biomarkers, treatment trials, immune abnormalities, epilepsy, speech motor behavior, PANS, neuroinflammation, and so on. Those who want to know more information about this, please go to the brainfoundation.org. So it's just brainfoundation.org. And then there's a lot of information. And if anybody is interested in applying for a grant, please, we put out information about our grant cycle. So please take advantage of that and join our community in helping to solve this problem. And I did not mention, yes, as Dr. Puli mentioned, I have a son with ASD as well, who's now at Berkeley doing mechanical engineering.